Today on Wellness with Wood, we are talking health insurance. Joining us now is Emily Martins, the lead territory manager at Priority Health. Thank you so much for joining us today.
Thanks for having me.
It is that time of year. Talk health insurance. Why is it important to get right now? Yeah.
So we are in our open enrollment period right now, which is the time to sign up for a plan if you haven't already, and that ends January 15th. And if you're outside of that period, you actually need a special enrollment event to sign up. So now's the time to be looking at those plans and making sure that you're covered.
Yeah, and talk a little bit about the importance of getting that health insurance before you have, you know, a scary health situation arise. Hopefully not, but you know, you want to think ahead, right?
Absolutely.
Yeah.
I think that a lot of us would rather not think about healthcare coverage, right? It's not a fun thing to spend money on. However, if you wait until something happens, then you could find yourself in a situation that you're not able to get coverage because, again, we are in that period right now to sign up, and they've actually really tightened the way that signups can happen throughout the year. So you do need a special enrollment event with documentation and things. You want to make sure that you have coverage if something happens. I will use the example, I have 2 children that have had, unfortunately, several ER visits due to illnesses and things like that. And so had I not had coverage for that, that would be tens of thousands of dollars out of pocket. So I'm a good example of why you want to have health coverage, especially if you've got kids.
Yeah, and you kind of just segued in, but what are some of the top reasons that you should be getting health insurance, especially right now with it being open enrollment?
Well, sure. So it's not just a backup plan for something bad, right? It is part of your wellness. So you want to get those preventive visits. A lot of times you can catch illnesses and things early. People can go and get their physicals, and doctors can, you know, make sure that they're doing that blood work and things that will find early signs of maybe like minor illnesses and sometimes even major. But if you wait for that kind of stuff, then it can lead to a point where you're needing a lot of treatment, and that is more money. It's time away from work. So make it part of like a wellness package along with, you know, other healthy activities that you're doing, but just having that in place and that preventive coverages are super top reason, I would say, to make sure that you have that for next year.
And it's interesting that you say that, you know, the element of wellness, right? What would you say are some misconceptions about health insurance?
I think that you can get it at any point. And again, the restrictions have been a lot looser in the past several years until 2025. So it's not something that you can just pick up whenever you want. There are things like short-term plans, but those are coverages that exclude pre-existing conditions. So you want something that you can go to the doctor. Sometimes doctors won't even take cash patients. So it's just not a great idea to go without it. And you might think, oh, it's just for emergencies and things like that. Well, let's say one of your kids or yourself came down with something. You want access to a network of doctors and testing and all of that stuff that could really help treat that or find out what's wrong with you.
Yeah, and for the viewers at home, I know you said it earlier, what are those key dates people should know? Any, you know, of that information, people, where can they look, things like that? Yeah,
so the last day that you can select a plan for 2026 is January 15th. If you wait until after December 15th, that's going to give you a February start date. So if you're looking for coverage in January, which most people are, you'd want to get your submissions in before December 15th.
Yeah, and questions, usually you go through maybe your employer or things like that, right?
You can go through your employer, if you're without coverage or you're self-employed and you need to purchase coverage, we do have those options. You can look at PriorityHealth.com. We've got an internal team that can help with that, and then we have independent agents all over that also assist with those purchases.
Yeah, thank you so much for joining us, Emily.
Thanks for having me.
Thank you.